All right, this is a great case. This is achondroplasia. So there are so many findings here, it's crazy, but there are flared metaphyses. Okay, that is suggestive of achondroplasia. There is an unusual orientation to the iliac wings. They are flat out like this. They look like Mickey Mouse ears or ping pong paddles. Both expressions have been used to describe this. Okay, you don't see the edge of the iliac crest, right? More in profile because usually they're more directed anterior to posterior. All right, so ping pong paddle pelvis. We've got flared metaphyses. And look at the inside of the pelvis. See this lucency here? That is known as a champagne glass pelvis, and that's just related to the orientation of the iliacs there, right? But you can see it is like an old-fashioned champagne glass, the flat, broad ones. That's a stupid way to drink champagne, by the way, because it lets all the carbonation out. So that's why they've now gone to the flute as the more appropriate vessel from which to drink champagne. All right, so the last thing on here, which is pretty cool to be able to spot on a frontal film, is that horizontal orientation of the sacrum. And you can just see it by virtue of the sacral arches. These are the posterior elements at the sacral levels. You've got a little spina bifida occulta there, right? But you can see because of the way these arches look, you shouldn't be seeing them in a tunnel like that. And that tells you that that sacrum is torqued horizontally. Oh, I told you this was crazy with findings. There's also a narrowing interpedicular distance. Okay, the interpedicular distance of the lumbar spine should widen as you progress downward. And in this case, look at that. Here are the pedicles here, a little closer together here, even closer together here. So that narrowed interpedicular distance is very helpful as well. So there we go, flared metaphysis, narrowed interpedicular distance, ping pong paddle or Mickey Mouse ear pelvis. And I just gave up putting all these circles on for the sacral arches there. But horizontally oriented sacrum is also part of those findings. All right. Contrast this with the fibrous dysplasia we looked at, right? There is loss of the cortex. There is a soft tissue density on both sides of the proximal fibula, and there is an aggressive periosteal reaction. So especially spiculated and perpendicular in appearance in this case. So this is the classic sunburst periostitis, and you should look at that and look at this periosteal reaction down here as well. Right? You should look at that and go, that is an aggressive bone lesion. Okay, this is going to be a Ewing sarcoma because of that sunburst periostitis. Certainly, osteosarcoma is a possibility, but they usually have a little more sclerotic matrix, and they're usually in older kids. So Ewing sarcoma is pretty much the diagnosis to call here. And look at how the cortex is gone. You've got that spiculated, perpendicularly oriented periosteal reaction, especially right here. And this is periosteal elevation as well, and a soft tissue density expanding beyond the limits of the bone. So that is a Ewing sarcoma. Remember, don't put possessive apostrophe S's on eponyms. All right. This might be our last one. Sorry. So this is a great case. This is a common presentation of this entity, and this entity being sickle cell anemia. So what you've got here is periostitis of the metacarpals. You see it on the 5th metacarpal right here, and on the 2nd metacarpal right there. right? So periostitis. The other thing that's really interesting here is on a frontal view, you can actually appreciate that there is significant hand swelling. Look at the soft tissues here. They're so prominent and sitting, they're overlying the hand here, and compare the prominence and density of these soft tissues to the finger soft tissues. And they should be a lot closer in density than that. So you can almost see kind of a circular density here. And that is the case. These patients present with massive soft tissue swelling. Okay, so this is the hand-foot crisis of sickle cell anemia. So this is actually, these are actually evolving bone infarcts that you're looking at here. And note, when on the mag views, you can really see there's some heterogeneity and disruption of the trabecular lawn compared to the less involved metacarpals. Let's look at the second metacarpal as well. You can appreciate that. All right, so this is an acute presentation of sickle cell anemia, and it is often the means by which this diagnosis is made in infants. This can be the initial presentation. So keep an eye out for this, and this is just a pathognomonic thing. You see periostitis in the metacarpals of an infant, it's going to be sickle cell. All right, this is good old George, my mentor. You can see, yeah, he loved to write on films, and he would do it. I actually decided I wouldn't take those off. This was in pencil. But I fondly remember the guy. He left me his teaching file in his will. And so I have a special storage facility here in my office where his original plain films are all stored. But yeah, he used to write all over the films, and he liked to do age and gender as well. All right, and so he's basically handing you the diagnosis because I told you in the 11 to 13 age range in pediatric pelvis films, there's one thing you're looking for, right? That you're going to look for first anyway. And that's a slip capital femoral epiphysis. And you can make this call on a frontal film. The right side is the side that's involved. Note that the physis is wider than on the opposite side. And the whole hip, the proximal femur, is hypodense compared to the opposite side. And that's a common finding here because what happens is there's significant inflammation when the epiphysis slips, and you get hyperemia of the involved joint, and the patient is ambulating less. And both of those things will contribute to a decreased bone density. So hypodense proximal femur and a widened physis. And you may be thinking, man, that is subtle. And it is. But I can tell you this is a call you can make and that I've made 3 or 4 times in my career. And you get questioned, right? People call up and say, come on, really? I say, get the frog leg. And this guy, I think we do have a frog leg on him. But very nice example. Look at the widening of that physis. That's the main thing to go by. Yeah, and there's the frog leg, and which they're usually quite striking, right? Especially when you compare it to how subtle the frontal is. You'll get these frog leg views and go, wow, had no idea it was that bad. Clearly doesn't line up, right? The epiphysis should be lined up nicely with this metaphyseal portion. So there's offset here and offset here. All right, are we out of time?
We got time for one more.
All right, we'll do one more. Oh, this is a great one. Have I said that every time? That gets old, sorry. So this is frayed metaphyses, right? You've got these irregular metaphyses and a sclerotic line within them as well. There's extensive periostitis. So down here, I would call that a chronic appearing periosteal reaction. But up here, they're starting to look crazy, right? It's really widely separated, and especially right here, you can see it's calcified. So there aren't many things that are going to cause that degree of separation of the periosteum from the bone. And kids have a loose periosteum. It is less adherent to the cortex of the bone than it will be in adults, right? It's a lot harder to lift the periosteum off an adult bone. But this is periosteum lifted completely off the bone, and then calcification occurred within. And that tells you that this is a subperiosteal hemorrhage, right? Because typically, if this were infectious, right, first of all, it would have come to attention a lot sooner, right, and would be less inclined to calcification, right? So this is what this is a subperiosteal hematoma here and here, and they are non-acute because they're calcified. So the other thing to point out here is what they call Wimberger sign, where you have a relative hypodense epiphysis, which makes the peripheral cortex appear slightly more prominent. And it's probably more apparent here in the tibiae. All right, so subperiosteal hemorrhage, Anfrade metaphyses, and Wimberger sign. Does anyone know what this is?
Scurvy, matey.
It is scurvy, and not maybe. No, very good job, Sean. This is scurvy, and the reason I say not maybe is because scurvy affects your connective tissue. And so that loose attachment of the periosteum to the cortex, that's made worse in scurvy because that's exactly the kind of tissue, those adhesion proteins that scurvy affects. And remember, scurvy, its other presentation is hemorrhage. It will make you bleed more easily in a lot of locations. Perifollicular hemorrhage was the classic presentation for the internist. And of course, you know that the gums bleed and people lose their teeth. And this tendency to subperiosteal hemorrhage is consistent with that. And again, when you do get a subperiosteal hemorrhage, the periosteum is so loose that it will be dramatically separated from the cortex. And as in this case, it can sit there and calcify. But that is a classic case of scurvy.